Hi, everyone. Thanks once again for joining Global Health Council this afternoon for our second advocacy update. This is Danielle Heiberg with the Global Health Council, and I'm joined by a number of my colleagues, as well as some of our colleagues who work with different organizations who'll be sharing some information with us today. For those of you who have not done one of our advocacy webinars, this is something new that we've launched this year. It is a quarterly webinar where we provide updates on our activities up on Capitol Hill and with the administration. They are primarily designed for those of you who don't normally do advocacy work here in Washington, D.C., or those of you who are not inside the Beltway type, though I do know we have a number of seasoned advocates who do join the webinar as well, so glad to have you. And for those of you who are not normal or typical advocates, we're glad to have you join us today as well. I try to keep these webinars a bit high level so that we don't get too in the weeds and too wonky with some of the political discussion. But if at any time you feel you have a question about something because I didn't explain it well, please do either put a question in the chat box or feel free to reach out to me independently post-webinar, and I'm happy to walk through anything that may have been confusing or I didn't explain fully. So the agenda for today's webinar, we will look at the current state of affairs. So we'll provide an update on the fiscal year 2020 U.S. appropriations process and where we are with that. We will be joined by Baney with the Global Health Technologies Coalition. She serves as the co-chair of GHC's Multilateral Engagement Roundtable, and she'll be providing an update on the high-level meeting on universal health coverage that's taking place in late September. And then we'll get an update from Shannon Kelman, who is with the Friends of the Global Fight Against AIDS, Tuberculosis, and Malaria, and she's going to give us an update on the Global Fund Replenishment, which is happening later this fall. And we'll also be joined by Matthew Rose, who works for HealthGap, but is leading a 2020 epidemics campaign that is targeting presidential candidates. So we wanted to provide some updates on that. And then finally, we'll close with just a few updates on pending legislation up on Capitol Hill. And then my colleague, Liz Colway, will talk a little bit about the UN General Assembly calendar and other moments happening this fall. So first, we do like to start every one of these webinars with a question about what is your experience being a global health advocate, and you'll be able to take that poll right there on your computer, and we can get a sense of who's on the phone with us today. Is it open? Okay. Are we ready? Okay, thanks everyone for voting, and I think we'll see the results. So, looks like today most of you are just getting started with your advocacy efforts, and we have a number of folks who have some experience, and then we have also a number who are seasoned global health advocates. So again, glad to have you join us. We will start off with some updates on the fiscal year 2020 U.S. appropriations process and update. Again, I try to simplify this process. There are many steps and in the timeline. And here's the basic timeline that we refer to when we think about the appropriations process. So what has recently happened is highlighted in blue, or will be happening, I should say. So a two-year budget deal was passed by Congress at the end of July, and we'll talk a little bit more about that on the next slide, which sets us up for the Senate to begin their work in the subcommittees to draft and mark up the appropriations bills. And then the House has actually had a floor vote on a majority of their appropriations bills. So they're almost done with this process. But looking ahead, or on the next slide, you'll see a little bit more detail on this timeline. Again, as I mentioned, the Congress and White House did agree to this 2019 Bipartisan Budget Agreement Act. This budget deal was necessary to establish the spending amounts for both defense and non-defense discretionary spending. In the non-defense discretionary spending accounts, that includes things like education, health, roads, as well as foreign assistance, so all those global health accounts that we care about. The budget deal allows the U.S. government to spend up to $324 billion over the next 2 fiscal years, so that would be for fiscal year 2020 and 2021, with the discretionary spending rising to $1.32 trillion for sorry, I misread my notes. It's rising from $1.32 trillion, which was the fiscal year 2019 level, to $1.37 trillion for fiscal year 2020 and $1.375 in 2021. Those are big numbers that we're throwing out there, but what Congress will be doing next is figuring out how to allocate those spending levels across the individual appropriations bills. So you'll see that in late July, just before the Senate recessed, we assume, though I have not received confirmation, that the Senate has worked on the individual spending bill allocations, and we expect those allocations to be made public in September. And these allocations, again, set the top level spending for each of the individual spending bills. And most of the global health accounts that we care about are in the USAID or at USAID and the State Department, and those are found in the Senate or the State Foreign Operations and Related Programs bill, commonly called the SFOPs. We also have global health programs both at CDC and NIH and HHS, and those are found in the Labor, Health and Human Services Appropriations bill, commonly called Labor H or Labor HHS. So we should know in early September how the Senate will allocate those numbers. Because the House has done a majority of their work on the appropriations bills, they will most likely go back and make some adjustments to their spending bills, since some of their bills did come in slightly higher than the total top line cap. We do expect the majority of the increase to the discretionary discretionary funding bills to go for some domestic priorities, such as the census and veterans' health. So we're not expecting to see a huge increase in foreign assistance and the global health programs. Again, in September, when the Senate comes back from recess, the Appropriations Committee will begin marking up their spending bills and hopefully send them to the Senate floor for passage. Because they have not started their process yet, it's going to be a tight schedule for them to finish up all of their spending bills before the end of the fiscal year, which is on September 30th. So we could see what's called a continuing resolution, which keeps the government open either short-term or long-term, but we do expect at least a short-term continuing resolution, or CR, to keep the government open while they finish up these bills. How the final appropriations bills will be passed remains to be seen. It could be that the Congress ends up packaging a number of bills into small spending packages and sending those to the president to be signed. Those are often called, or not often, but are called mini buses. Sometimes in the past, Congress has passed what they called a omnibus, which is all of the spending bills rolled into one spending package. However, President Trump has indicated he does not intend to sign any more of those. He did do that his first year in office and was not pleased. So we'll be continuing to monitor how Congress finishes up the appropriations process for the upcoming fiscal year. And for those of you who follow the appropriations process closely, and even if you don't, just to make everything even more confusing, many of us advocates have already started working on the fiscal year 2021 process. So we are now working on our recommendations and justifications for that process to submit to OMB, which is the Office of Management and Budget, and puts out the President's budget in the spring. So we have two concurrent processes going on at this moment. It's quite a lot of work for us here in DC. On the next slide, you'll just see this is the chart that I use internally and often share in our advocacy updates, but this provides the quick look at where we stand on funding. So you'll see there's a column to compare the fiscal year 19 enacted, what the President requested for this year's budget, what the House has passed, and then our recommendation. I've highlighted in red where we saw increases in the House numbers, and so we're just awaiting those Senate numbers and then the final enacted numbers. If you would like a copy of this chart, we do have it available on our website, or you can always contact us, and we will be happy to share this with you as well. This is the part where I might get a little tiny bit wonky, so apologies ahead of time. This process that I want to highlight here is not an easy process to explain, but I did want to make sure that we talked a little bit about this. On Monday night, the Washington Post did report that the Trump administration sent a letter to the State Department and USAID asking them to provide a report on unspent funding for a number of programs, primarily in the foreign assistance arena, including global health programs. What this does is it has now frozen funding for any of these programs while the State Department and USAID provide the response to the White House. This is the start of a process that we call rescission, which is where the White House can signal to Congress its intent to want to cut appropriated funds, but however, it is appropriated funds that have not been obligated or spent at this time. We don't have very much information on it. For instance, so we don't know specifically which global health programs have been targeted. We do know that it is for fiscal year 18 and fiscal year 19. And the expected impact of these potential cuts could be $2 to $4 billion. We expect once USAID and State Department respond to the White House will send what they call a special notification up to the Hill with their request to cut the funding and in which programs. At that time, Congress has 45 legislative days to take action, and from there it starts to get a little complicated about how the committees vote on it, if they decide not to take action, and the special notification on the rescission expires. I have a little primer on this on our website, so if you're interested in kind of learning more about how this process works, I'm again happy to share that link with you. I don't want to get into too much detail about the entire thing, but did want to flag this for our community, since this does mean at this point that funding for the global health programs for FY 18 and 19 are frozen, and the agencies are unable to make the obligations to actually spend the money. And with that, I would like to turn it over to Jamie Baney, who is with the Global Health Technologies Coalition and also the co-chair of our multilateral roundtable. And Jamie's going to provide an update on the high-level meeting on UHC.
Great, thanks Danielle, and wow, that feels like a big shift going from the US Congress and budget and all of the things happening here in Washington to thinking about multilateral policy and advocacy. I think just to kick off my portion of the conversation, if you click to the next slide, please, we have a question for you. So, how closely have you been following the upcoming UN high-level meeting on universal health coverage? And we'll just give everybody 30 seconds to chime in there. All right, maybe we can look at the poll results. Ooh, very closely, 23%, somewhat following, 70%, not interested, 7%. Well, for those of you who are in the 7% category, I will keep this pretty short and pretty brief, and happy to take follow-up questions at the end or offline. So click to the next slide, please. Just think for level setting, it's important to just understand there have been some different definitions thrown around about what is universal health coverage. If you look at the WHO website, there's an even longer description. This is sort of the medium length version. But again, for level setting, universal health coverage means that all people and communities should have access to the quality, promotive, preventive, curative, rehabilitative, and palliative care services and products they need without incurring financial hardship. And I think a lot of us in the global health community really hang on the idea of all people, quality, and then without incurring financial hardship. So often that's how you'll see the short version presented. This is often a question that also comes up as we sit, many of us in the United States, and we watch domestic conversations ongoing about health care, whether there should be a single payer health insurance system, insurance, all of those things. We actually park a lot of that conversation when engaging on this topic on universal health coverage and really look at it in a broader sense. Next slide. So what is this universal health coverage thing? What is the timeline? Why does this year matter? I thought it might be helpful, sort of the way that Danielle walked through the US timeline, to do the same for UHC. So this conversation around UHC started far before April, but I just wanted to highlight some key moments across this year and then kind of where we're heading looking to September. First of all, back in April, on the 29th of April, there was a UHC multi-stakeholder session in New York where civil society, other stakeholders, governments, really a whole diverse group of folks were able to come to New York and provide input on what are the priorities and sort of what should be considered as part of the framing on UHC. And I think this is a tricky topic because I think UHC means something to everybody, but not necessarily the same thing to everybody. So there's been an incredible amount of input and dialogue around UHC this year. That dialogue carried forward into the World Health Assembly. And part of the reason there's so much interest in UHC is that Dr. Tedros, the head of the WHO, has articulated that his framing in terms of how WHO prioritizes its activities should be thinking about UHC. And then starting this summer, but ongoing, has been work by different countries to come together and negotiate the language for what we're calling the UHC Declaration Zero draft. So the idea is that when we get to September, there will be a final declaration about UHC that's been negotiated by UN member states. And interestingly, my slides have had to change a little bit even in the last week. This is a bit like Danielle talking about the breaking news about the Washington Post article and rescissions. In the multilateral space, about 2 weeks ago, at the end of July, there was a finalized, in quotes, UHC zero draft. So that's basically saying kind of the first round of agreed upon language for the UHC declaration. And we thought that a lot of the countries had finished their negotiations, some hard fought conversations on wordsmithing, very, very specific line items of this document, and that it would be done, leaving 1 month of contemplation period, and then kind of reopening. Then how do you build on that going into the meeting, the high-level meeting in September? The way that processes work with these types of declarations is that there's typically a silence period. In this case, it was a 5-day silence period that was supposed to happen after negotiations closed on July 24th. And in this case, several countries, we don't know exactly who, it's never shared, but broke the silence and said, actually, we do still have concerns and questions about what this zero draft language looks like. And I think it's important to just pause for a second and say that a lot of where the heated debate between countries have been within SRHR and migration issues. Also, a lot of discussion around the price of health products and how much transparency there should be around research and development of health products. So a lot of access and IP issues, reproductive health, also just a really, really big area for debate among countries. So it seems that some of that negotiation process has stalled. Again, this is all sort of breaking news within the last few days. And we're waiting to see sort of how negotiations move forward as countries try to get consensus on a zero draft. The other thing that's practically shifted then in the last week is that where it was typically kind of almost a Sherpa team or kind of individual sort of technical experts from different member countries were helping to do these negotiations. The negotiations have now been escalated, if you will, to the ambassadorial level. So you've got the ambassadors to the UN of different countries, and now they are in the hot seat negotiating what this zero draft language should be. So it's, again, a bit wonky, but I think it's important to pause and mention that where it sort of sounded like things were done or semi-done a week or so ago, the conversation has been reopened for input and additional debate. The hope is still that there will be an agreed upon zero draft as a framework for the conversations going into September. So getting to September, I also think it's very important to flag August 9th, that's this week, which is the deadline to register for the UHC high-level meeting. It's not just an event or a meeting where you can go to a website and sign up and say, okay, great, Eventbrite, sign me up. There's actually quite a few steps to be involved and participate in that high-level meeting. There's a lot of space constraints, and it's a bit challenging to actually have a seat in the room. So I just wanted to flag that any organizations or individuals who are thinking about participating, they need to be registered through an entity that has ECOSOC accreditation or an existing high-level meeting special accreditation. And I know that Liz might get into some of this, or as we start to talk about UNGA, what's going on there. I think for a lot of us in the global health community, having a seat physically in the room is not necessarily all of our priorities when going to the UN General Assembly. Obviously, we care deeply about this issue, but also realizing that in some senses, a lot of the negotiation has already been ongoing. And I think it's a big moment as we look to September. So what happens on that day in September 23rd? We watch countries continue that dialogue and make commitments. But I think for us as advocates and as the broader global health community, the bigger question isn't what happens that day, but how is that the starting point for many future conversations and future commitments to be made. Looking at September 23rd, we've also been tracking who from the US government will be participating. We don't know all the stakeholders who are going from US government to New York, but we do know that the delegation will be led by Secretary Azar, the head of HHS. Can you go to the next slide, please? Great. So again, I got into this a little bit, but what to expect in New York? I think we'll be watching with a lot of attention that day on September 23rd to see what specific country commitments are made, and also to take a step back and reflect on why does this matter. Part of the reason I think that the UHC has come up with it as a priority, as this high-level meeting is being planned, and as leaders around the world are saying, yes, UHC is a key moment, and this is a key time we need to discuss, is because the HLM, the high-level meeting, will be the last chance before 2023 to mobilize high-level political support for the broader health agenda. And 2023 matters. It may seem like an odd year, but that's the midway point on the Sustainable Development Goals. So if we're looking at the Sustainable Development Goals being 2030, 2023 is the midpoint. And what we've been looking at is with the Sustainable Development Goal 3 for good health and well-being, there have actually been quite a few concerns that we are not on track to hit our targets for health. And so this is a great opportunity to galvanize and mobilize more political support for health and an umbrella of all these health topics put under UHC to help to work towards and make better progress towards those milestones. What does that mean in practical sense for a lot of us as advocates, and again, the broader global health community? I think we'll be looking and monitoring closely to see where high income countries, are they making additional financial or political commitments to support UHC broadly? And then at low and middle income countries, how are they considering UHC as they look at their health of their own populations? Are there additional efforts or requests being made of ways to bolster capacity, capacity building or other factors that help to achieve these UHC goals? And then I think it's also a great convening opportunity for other stakeholders, whether it's the private sector and civil society and others, to come and say, this is how we contribute to the UHC conversation. So a lot coming into this conversation in September, and I think the important thing to think about is UHC isn't done. We're not going to get to September 24th and stop talking about UHC. I think you will find that this is the beginning of a much broader conversation, and UHC will be a framework for a lot of our multilateral advocacy and policy work, certainly for until 2023 and probably longer. So I'll stop there. Thank you.
Thanks, Jamie. We'll go ahead and answer questions at the end of the webinar. So if you do have any for Jamie, please do get them in. You can type them into the chat box. I did want to flag, because I don't think you mentioned this, but we have also just heard that the declaration was put under the silence procedure again last night. So we have another 5 days to see how member states respond. But I think they're thinking that it might, the silence procedure might be broken again around the countries who want stronger language on sexual reproductive health and rights. So just want to flag that. For those of you who are not engaging with our multilateral roundtable and would like to do so, please again contact anyone on the GHC team, and we'd be happy to add you to that roundtable to become more involved. As Jamie said, the conversation doesn't end on September 24th, but this roundtable also engages around the G7, G20 process, as well as WHA more broadly, so we would definitely welcome more advocates to join us. Next, we're going to turn to Shannon Kelman, who works with Friends of the Global Fight Against AIDS, Tuberculosis, and Malaria, and Shannon is going to provide us an update on the Global Fund replenishment.
Thanks so much, Danielle. As Danielle mentioned, I work with Friends of the Global Fight Against AIDS, TB, and Malaria. We are an advocacy organization that focuses on the Global Fund. The Global Fund this year is having its replenishment conference in October. The Global Fund is a multi-stakeholder, donor country, private sector, private foundations, all of the above, fund to end the 3 epidemics, and they fundraise on a 3-year cycle. This year is a replenishment year, which means that in October 9th and 10th in Lyon, France, they will be accepting pledges from all of the various stakeholders involved as to how much money everyone pledges to contribute over the 3 years. The Global Fund released in February their investment case, that is their target amount of money for how much they are aiming to have pledged in October. And that is a goal of $14 billion over 3 years to end the epidemic. That's a 15% increase from the last replenishment cycle, the 5th replenishment in 2016, and what is seen as the minimum amount needed to end the epidemic. With their target for the $14 billion, they are also including a projected increase of 48%, so right around $46 billion to be contributed from domestic resource mobilization. That is, recipient countries committing their own money, and as Republicans on the Hill often phrase it, have their own skin in the game to end these epidemics. The increase for the U.S. side would be $210 million each year. So as we're focusing, as Danielle mentioned, on FY20, the increase for $210 million would help buy things like another 1.19 million houses receiving residual sprays to protect against malaria, an additional 42,000 women on treatment to prevent transmission of HIV in utero, an extra 290,000 people receiving care for tuberculosis and additional related treatments. So it could have a massive effect on the spread of the diseases and the impact. The goal for the $14 billion over the 3 years will be to reduce the number of projected deaths from AIDS, TB, and malaria by nearly 50%. That's cutting the amount of deaths in half, and is projected to save an additional 16 million lives and avert 240 or so million infections or cases of disease, and with that spur $19 in economic returns and health gains for every $1 invested. So it's a very worthwhile investment and something that we are optimistic on. As you've heard from Danielle on the appropriations process, the U.S. has a line item in appropriations directly for its contribution to the Global Fund. And that will be essentially taken as the pledge from the U.S. government to the Global Fund for at least the next year, though hopefully projecting forward for the next 3 years. The House, as you heard, has moved forward with its state and foreign operations funding bill, and will have, and included in its bill, the ask for $1.56 billion, which is the $210 million increase. And so included what we as advocates in DC were hoping to have included as the U.S. pledge going forward. We are still very much in a holding pattern with the Senate. Our champions on the Hill indicate that we will be happy with what the Senate does, but as everything in DC, it's very much a wait and see, and trying to push our friends on the Hill to be the champions that we know they are. As we move towards October, we are also working with our partners globally to ensure that other donor countries are stepping up as well. We've already had announcements from a number of countries. So Japan has indicated a 5% increase up to $840 million, which is particularly noteworthy given that they had a significant increase in the fifth replenishment and had been indicating to advocates they were not planning to increase this cycle. The United Kingdom announced a 16% increase. Portugal, Luxembourg, Ireland have all announced significant percentage increases as well in their pledges. The German pledge has been budgeted, which is a public document, but they have yet to actually formally announce their pledge, which is a little bit of one of those diplomatic nuances. But we expect roughly a 25% increase from the German government. We are also waiting on, and these are our particular points where we're focusing globally, the Canadian government has not yet made a pledge. They made a significant pledge last cycle as they were the ones to host the Replenishment Conference. And so we are working with our Canadian partners to try and push the Canadian government to increase as well. And then we're waiting on the French government contribution as well. Because France is hosting the Replenishment Conference this year, it is likely that we won't hear about their pledge till much later, and that they will attempt to fill in a bit of the gap. So as we move forward with replenishment and try to leverage other donors, a good thing to highlight is the U.S. is capped at contributing no more than 33% of all Global Fund funding, and that is intended to be a global leverager, to say this is how much we would like to pledge, but if the rest of the world doesn't meet us 2/3 of the way, there will just be money left on the table. So a large part of our advocacy on a global level is to make sure that other donor countries are stepping up commensurate with how we believe the U.S. will step up, so that we can really make sure that we have the minimum amount of funding that we need, which we see as $14 billion over 3 years, to finally end the epidemics, and which would hopefully be very much in line with SDG 3, as Jamie just highlighted. I think that's pretty much it for me as well.
Great, thanks, Shannon. And again, if you have any questions for Shannon, please do put them in the chat box, and we will have her respond to those at the end of the webinar. We are now, and actually this is a great segue to Matthew Rose, who is with the Health Gap. Matthew is helping to coordinate a 2020 epidemics campaign targeting the presidential candidates, and dovetails quite nicely with the replenishment on the Global Fund. And I'm going to turn it over to you, Matthew. You might have to unmute yourself.
There we go.
Yep, there you go.
Excellent. I thank everybody for giving the opportunity, especially Danielle, to talk about this today. My name is Matthew Rose. I'm the Director of U.S. Policy and Advocacy for Health Gap, and I'm also the campaign coordinator for a project that a number of organizations are working on, trying to get the next president, whoever he or she may be, to create a bold plan to end the epidemics of HIV, TB, and malaria. We think that we are at a current place where we can change the course of these epidemics, and if we make strong investments with smart policy decisions, we can create a just framework that changes these epidemics that we know will actually worsen with the effect of climate change. And so we began this project back at the beginning of the year and have engaged with all top of the 5 contenders, but we're engaging with all the campaigns. We're a nonpartisan effort, trying to get everyone to recognize that they need to come out with plans and tell us what they're going to do to end AIDS, TB, and malaria. And we know, based on data, that this is possible, but it will take an effort of resources and leadership. We'd also note that since pretty much since Kennedy, every president has had to deal with a major public health crisis. And we think that this is an attempt for a president not to deal with the public health crisis, but to create one of the largest humanitarian efforts by ending 3 of the deadliest diseases of our time. You can see on our screen is the website below to find out more information. We've got over 38 different organizations working with us and supporting this idea. You can check out more information on our website. I'll leave it open for questions that will come later.
Great, thank you, Matthew. I do also want to emphasize that we know there's a number of other campaigns and educational opportunities that are out there working during the presidential election cycle. So, please feel free to share that with our team, and we're happy to pass that information along as well. We look forward to continuing to work with everyone in the upcoming election cycle to make sure that our issues are front and center during this campaign. I am now going to turn to legislation that is up on Capitol Hill. I'm compiled a number of bills that have been introduced on Capitol Hill. Some of them had been introduced the last time we did a webinar, so you'll see some repeats, but did want to flag a few of these for everyone who's joining us today. I will not go into detail about any of these bills, but you will see that all of the bill numbers are included, and you can find more information on the particular bills on congress.gov, or if you read our advocacy updates that come out in our weekly newsletter. The first one I do want to flag is the Global Health Security Act. It was reintroduced by Congressman Connolly and Shabbat earlier this year. This is a bill to codify the U.S.'s approach towards global health security, as well as codifying how our agencies and the U.S. government works together to respond to infectious disease outbreaks. There was also recently a frontline health workers resolution introduced by Congresswoman Lowy and Congressman Diaz-Balart. This is a resolution recognizing the work that frontline health workers put into many of the many programs that we support and implement. In addition, many of you have probably heard of the Reach Every Mother and Child Act that has been introduced for several Congresses and unfortunately has not made much progress in having a committee hearing, but it was reintroduced in the Senate by Senator Collins and Senator Coons. And this is to develop a strategy to eliminate preventable child and maternal deaths. We are expecting a House bill to be introduced sometime this fall, so stay tuned for more information on that. And just before the Senate went into recess in August, Senators Menendez and Young did introduce the End Tuberculosis Now Act of 2019. This is essentially a reauthorization bill on the U.S. work towards finding a cure and addressing TB. And then we do have two resolutions, one in the House and one in the Senate, to address maternal and child malnutrition. And finally, just a couple more to run through. The End Neglected Tropical Diseases Act that Representative Chris Smith has been a big champion of the past few Congresses has actually had a vote in the House Foreign the House Foreign Affairs Committee earlier this summer. So that's good news on that bill. It's making some progress, and we could potentially see it on the House floor for a vote. There are also two bills, again introduced, one in the Senate, one in the House, called the Ebola Eradication Act of 2019. This is actually a bill to make sure that funds are available for USAID to respond to the ongoing Ebola outbreak in DRC. These bills were introduced because the DRC is subject to sanctions under the Trafficking in Persons report. So these pieces of legislation are intended to clarify that emergency response funds are not subjected to those sanctions and that USAID has access to that funding. And then in addition, this had been introduced earlier this year, but just to remind you that the Global HER Act was also, it also has a bill in both the Senate and the House, and this is regarding the eligibility, would remove the eligibility restrictions on non-US NGOs in regards to whether or not they provide abortion services, counseling, or referrals. So that is related to the Mexico City policy. Those are some of the bills we're tracking. I know that there's a number of bills that deal with development more broadly, such as one on global fragility. There is possibly a resiliency bill being introduced later this year. So, but I did want to highlight some of the key ones that Global Health Council specifically is following. And then someone just sent me a question. Sorry, I can't read it right now. And just you know, we're always asked what can non-DC or seasoned advocates be doing. Just to provide some recap of things that would be helpful for us is, of course, we do want to oppose any new effort to rescind funds. Again, this is going back to that Washington Post article that was printed on Monday. We encourage the Senate SFOPs to support our global health and development accounts at a minimum of fiscal year 2019 funding. And then, of course, we cannot forget the critical global health accounts at CDC and NIH. So encouraging the Senate Labor, Health, and Human Services Committee as well. I think there was a question coming in, and I don't see it. Sorry. Nope. Okay, so I'm going to turn it over to my colleague Liz Colway, who is going to talk a little bit about some upcoming global moments, and then we'll turn to Q&A. So if you have any questions or anything you'd like to contribute to the discussion, please do put it in the chat box now. I know Jamie, Shannon, and Matthew are also still available to answer any questions you might have about the information that they shared.
Great. Thank you, Danielle. And just on a logistical note, before I go through this section, I did want to point out that we have uploaded the PowerPoint presentation, which is in the handout section. So we'll be sending that around again after the webinar, but in case you want to download it now, you can do so. So yeah, I just want to quickly go through a few additional global moments. Before I get started, I'm going to go back to UNGA, which I know Jamie talked about before. We do have another quick poll, which is a bit similar as the one we just had earlier, but wanting to know or get a sense of who all on the line will actually be attending UNGA. So I'm going to just do a quick poll right now. Okay, great. Thanks everyone for participating. Let's see if I can share the results. Oh, it's up there, okay. Great, so it looks like a majority of you are going to stay back home, but you might have a colleague attending, and a few are still attending. So I'll, again, go through this section rather quickly. So I just wanted to give you a quick overview of what GHC is planning at UNGA. We do still have a few events that are kind of TBD on date and time, but we are committed to going to the high-level meeting on UHC on Monday. We have a representative, our executive director, who will be attending that meeting. In the late afternoon, we are partnering with the Access Challenge. They're actually leading this event called Achieving UHC, A Sustainable Future for Africa. And they're really looking at the intersection between UHC and climate as well, since those are both the two high-level meetings on that Monday. There's also an evening event that is hosted by the U.S. government on AMR. And then on Tuesday, we have an event that's focused on patient perspectives on UHC. Global Health Council is bringing along 2 patient champions as part of our small kind of delegation going to UNGA this year, and they'll be moderating actually a few panels to give that patient perspective on UHC. Again, most of these events, the invitations are forthcoming, so definitely check out our special events calendar online. It's still being populated. You can, if you do go to it today, you'll notice it is a bit sparse. So if you or your colleagues are attending UNGA and co-hosting or hosting events, please do share that information with us. I also know a few other organizations like Global Health Strategies and United Nations Foundations are populating their own calendars. So really, we're trying to source the health-related events, understanding that the General Assembly is, covers a multitude of issues, but we're really just focused on the health ones, as I'm sure many of you on the call are as well. As far as additional global moments go, we actually did send out an events update newsletter last week, kind of looking at the latter half. Clearly, the list was definitely not exhaustive. I know there's a number of other events and conferences and webinars going on throughout the year, but we tried to pull out some of the kind of larger conferences and World Health Days. And I think these can be key moments in time to really put forth your advocacy efforts. I know we talked about a ton of pending legislation and other issues like UHC, and I think these are all great moments to be elevating those messages. So do visit our website to check out that calendar. And again, if you have additional events, send it to us so that we can populate our own calendar and make it more useful for the community. And with that, I will go back to Danielle. I know we have a few questions.
Actually, only see one.
Maybe a couple.
No, actually we don't. And so if you have any questions at this point in time, please do type them into the chat box. I do know our guest panelists do need to jump off at 1, so get them in now, and we'll wait just 30 seconds for folks to type their question in.
So we do have a question. Is there a link with information on the roundtable?
Yes, the information on our roundtables are on our website, but we can go ahead and include that in the follow-up email. There are a number of global health roundtables in DC, so this page on our website does list all of the roundtables and their respective co-chairs and how to get in touch with them, including the multilateral roundtable. So we can send that link around. Nyana, were there any other additional questions?
Yes, we do have another question, and this is from Rose Snyder. So is there an interest in briefing the international health section of APHA? There is an advocacy committee with a membership of over 2,000 members.
Great, thank you, Rose, for asking about that. We'd be happy to touch base with you offline and see if that would be a possibility. We're happy to discuss that. Thanks. Okay, well, it doesn't look like there are any questions. Hopefully that means that we were efficient panelists today and got all of your questions answered. Thank you again for joining us. If you do have additional questions that come to you later, please feel free to reach out to anyone on the GHC staff, or you can reach out directly to some of our panelists. I believe it should be easy to find their contact information, or we can include it in the follow-up email. And we'll be hosting another webinar towards the end of the year, and probably be providing hopefully some updates on the Global Fund replenishment as well as the outcome of the high-level meeting. Thank you very much, everyone. We really appreciate you joining us today.